with the provinces and territories, and of course with the Public Health Agency of Canada, with the World Health Organization, with the Centers for Disease Control. We've taken measures, as Manitobans know, to get supplies into this jurisdiction. Manitobans have become familiar with the phrase personal protective equipment, PPE. I am able to update today and say that those supplies have already begun to flow into Manitoba, but we need much more. Other initiatives we've undertaken to ensure that our healthcare facilities are prepared include purchasing 27 new ventilators that have now arrived in Manitoba, and purchasing an additional 16 ventilators that are on their way. In addition to this, we've brought in a nucleic acid extractor to help in our laboratory. We've brought in UV disinfection units to very, very quickly clean spaces in healthcare facilities. And we're bringing 10 new chest compression systems, and those and when they arrive, will be distributed across the province. We have seen incredible improvement at our Health Links Info Santé telephone-based service. Manitobans know that in just a matter of weeks, we have seen thousands of calls come in. I understand 20,000 calls in just the last 8 days. Even today, a record-breaking day for the number of calls received, and yet wait times to get service have fallen to 23 minutes. That's an incredible undertaking and an incredible success story on this challenging landscape. Our online assessment tool continues to receive more and more activity every day. I believe now we've crossed the 250,000 mark when it comes to visits to that page. And today we opened our 12th community screening site. Incidentally, this one in my constituency, in the city of Winkler, another drive-through site at the Winkler Arena. And that site, plus the 11 others, are serving Manitobans well. We are opening 2 other sites before the week will be out. Manitobans are always reminded, do not just show up at the screening site. Go online, get assessed on the online assessment tool. Then, if required, phone in to Health Links. The wait times are way down. And then, if required, you go to the screening site. Or I should say you go to that community screening site. All these measures are designed to flatten the curve of positive cases here in Manitoba. Ces mesures visent à aplatir la courbe des cas positifs ici à Manitoba. I have been amazed by the partnerships that have come together as this pandemic has arrived here in Manitoba. We know as a government, we acted very early in the healthcare system to sign a memorandum of agreement with labor unions that would allow us to appropriately and in cooperation with unions shift workforce as required to be responsive and to put patient safety first. That's a success story. Also a success story, our partnership with Doctors Manitoba to be able to bring together some new tariffs for virtual visits, for doctor visits, for psychiatry, allowing their patients to get access to their doctor for a consultation, for a diagnosis, for ongoing wellness, even for prescriptions that are new or prescription refills without ever going to see their doctor. And we know how important that is right now with social distancing. We've also worked with Pharmacists Manitoba. We know that we're limiting supply reorders to 1 month, and that is to protect supply in our province. Every other jurisdiction is undertaking that step. But we've also made sure that we have, and we announced yesterday, frozen the pharmacare deductible levels at last year's levels. So once again, on April 1st, pharmacare deductibles will not be rising. That is one way that we can help Manitobans who are under strain at this time. I want to give a shout out to other partners who are acting. I became aware yesterday, and so many Manitobans did too, that the Health Sciences Centre Foundation has initiated a campaign that we know because of the suspension of visitor privileges on hospital ward is creating difficulties for communicating with loved ones. And HSC Foundation is stepping into that gap and challenging their donors and all Manitobans to help them raise money for cell phones and for iPads to allow allow their patients to communicate outside the walls of the hospital. And there are so many more partnerships like that. I can report to Manitobans that last week I made a call to the president and CEO of Dynacare. And Dynacare is, as Manitobans know, an important partner now in our healthcare system. And within a matter of days, Dynacare has marshaled resources so that now they have people helping us to phone those Manitobans who have been tested and who are awaiting the news that their test for COVID-19 tested negative. And we understand already that Dynacare is operating their services to help today, and that is having an effect. In addition to this, we know yesterday we launched the helpnextdoormb.ca. That's the new online portal to match people who can help with people who need the help. And I just heard that there were already 131 cities and towns registered for this service, and literally thousands of people signing up to either do a good deed or signal that they need one. These are the best qualities of Manitobans on display for everyone to see. The phone in my office and the phones in the offices of the ministers and premier have been ringing daily, emails coming in from Manitobans who want to help. They say, how can we be part of the effort on COVID-19? And this includes business, industry, manufacturers, and retailers. And so our news today is that when people are asking how can they help, we're saying today you can. We are pleased to announce that as of today, we are opening a new online portal that will allow companies to register and to be able to provide the goods and services and the materials that we need to respond to COVID-19. So we have this online form, and we will provide the information about where you can find that. We have a job to do to make sure that we have the specialized equipment that we need for front-line healthcare workers, for the patients that they will serve, to provide the best possible care to patients and to keep our healthcare providers safe in the performance of their duties. For those who can provide items out of existing inventory, great. For those who are prepared to retool, or to stand up capacity to manufacture new things, that's fantastic. With this online form, business leaders and managers can list and detail other products and services that they can offer to help out. This initiative is designed to help remove barriers that will allow Manitoba businesses and manufacturers to redeploy capacity towards the production of essential equipment. So let me list some of the things that we need. We need disposable N95 masks. We need surgical masks. We need nitrile or medical grade gloves and vinyl gloves. We need surgical gowns and medical gowns. We as well need the laboratory reagent. We need hand sanitizer, cleaning supplies, disinfecting supplies. When it comes to the services that Manitobans can provide, these include nursing services, public health, medical help, guard and security services, food and laundry services, transportation services, pet care services, IT services, and consulting services. We recognize that our supply chain could get affected going forward in this challenging time, and Manitobans have many skill sets, Manitobans have many resources, and we're encouraging you to help out your fellow Manitobans by asking local vendors to produce or contribute the supplies and services we need. We're wanting to be clear on this. We're not out of supplies. We're doing this out of an abundance of caution. Manitoba is arguably ahead of many other provinces when it comes to preparations. We moved more quickly than some to close schools and to suspend daycare services. We moved more quickly than some to limit the amount of people that can gather. And we're doing this in order to keep Manitobans safe. So while we have supply and products right now, we know we're going to need more. This is all about helping out. So to close, I express again the need for Manitobans to take basic but necessary precautions. We all know the things that we're being told to do every day. Wash your hands, cover your cough, stay home if you're sick, maintain a 2-meter buffer zone between you and the people around you. Je veux réaffirmer la nécessité pour les Manitobains de prendre les précautions nécessaires. Lavez-vous les mains, couvrez-vous la bouche lorsque vous toussez et restez à la maison si tu es malade. As the together when it comes to combating COVID-19. We need compliance from Manitobans right now. We need their cooperation. We also need their compassion. We're calling on business, industry, manufacturers, retailers to help us. Get to that portal, sign up. We're all in this together. Let's get about the business of helping out. I'll take.
Will pass at this rate.
Thanks for the question, Scott. It's a bit difficult to answer because there are so many categories of equipment. But I would say this, we worked very well and quickly and in advance to inventory the things that we have and then to make lists of the things that we would need. I must give a shout out to our procurement branch and the procurement leadership group at our incident command structure that has really pulled out the stops to make Herculean efforts to get what we need in this jurisdiction. But remember as well, we worked collaboratively with the federal government. We were the first province to sign on to that procurement order. Some supplies have began to flow into the jurisdiction. We're watching and we're working collaboratively to make sure we can get more. But I would say at this point in time, we're also solving problems along the way. When we became short of reagent, we found a way to produce it here.
And just to follow up to that, is there anything specific right now that the province, obviously there's lists here, but is there anything that the province is quite short on at the moment?
I would say at this point, there'd be nothing that I would signal that has been brought to my attention as being quite short in supply. However, I can say that I did ask the federal government for much more specific information on what is coming our way, and so I'm pleased to say we're working collaboratively, and even within a few, just the last few days, we've received additional detail on what is traveling to Manitoba, on what basis, and besides that, of course, we're undertaking, of course, on our own to make sure that we can pull out all the stops to get what we need. However, also our call is out to jurisdictions that are adjacent to us, and even within Manitoba, that if there is product that we have in places where it is not utilized, we need to centralize that to make the best use of it.
Thank you.
Canadian Press, Steve.
Hi, Steve Lambert from the Canadian Press. Mr. Friesen, you mentioned a new fee for virtual visits by physicians so that they can treat people without coming in close contact. Can you say what the fee is in terms of, is it the full fee compared to an in-person visit? Is it reduced?
It's a good question. So I'm pleased with this partnership. I believe it's the right move at the right time, and we got there through collaboration. And it's a tariff. So we've created a new tariff. We know that doctors who are fee-for-service, they make their money by charging to the system the services they perform. And in this case, exactly as you say, this tariff is designed to be equal to the amount of the fee that could be charged if someone was in the doctor's office, so as to provide no negative consequence for a doctor to provide that service to a patient remotely, by phone, by video, for the duration of this particular challenge.
And as a follow-up, are you able to talk about the backlog at Chatham Provincial Lab, how bad that backlog is in terms of test results and when we might see the backlog addressed?
So every jurisdiction is experiencing a backlog as more people get tested. So I would say at first that if one was an optimist, they could state that the backlog in some ways is an indication that the front end of the system on collection and that evaluation is working. However, we know the challenge before us. There were only a few days ago when Manitoba was actually one of the leading provinces in terms of the number of daily tests. I've asked for updates as recently as yesterday. I'm told that we are looking to clear backlog and that we should be back to doing almost 500 tests per day within a matter of days. Part of that success story was our ability to get reagent supply to the laboratory.
Thank you.
From CBC Radio Canada, Mohamed.
Hello, Mr. Friesen. It's Mohamed Amin from Radio Canada. I would like to ask you a statement about the new website for the businesses in French, if you can.
C'est un peu difficile pour moi à répondre en français à ce sujet. Premièrement, peut-être en anglais?
Yes, no problem. I have another question in English too. It's about international students. What does the province say to international students who cannot work on these times but have to pay their school fees and bills?
So first I would state that as the Minister of Health, we're endeavoring to all stay in our lane, especially with the pressure right now in place on all the departments. It is a question that is one better posed to the Minister of Education. I know there's challenges out there for all kinds of groups, but I would say today our government is acknowledging the pressure on all Manitobans. We've acknowledged that in a number of ways that will help all Manitobans, and we say stay tuned for additional information on how we're trying to focus at this point in time our efforts on helping those who are most vulnerable and who are most affected by the issues that COVID-19 is presenting.
Great. Thank you very much.
From CBC Manitoba, Barclay.
Minister Friesen, Barclay Mr. CBC. By now, I'm sure you're familiar with what Ottawa announced this morning in terms of the mandatory 14-day quarantine. How will Manitoba enforce this? How will you ensure people coming in by plane, by automobile, over the border actually get into that quarantine, stay in that quarantine? How are you going to get them from the airport to a quarantine? How does this work?
So I can tell you that these were measures that were also being contemplated in Manitoba by our Chief Provincial Public Health Officer. We know that the information out there right now is very good in instructing Manitobans who are returning from out of jurisdiction to get home and then to stay home for their protection and for the protection of others around them. However, we know that in some cases this message has not been getting through, and so the actions of the federal government today in respect of this Quarantine Act and this new provision gives additional powers. We are interfacing with federal officials to understand what enforcement measures will initially ensue from that statement. But I would also say that there will be an immediate effect that we would expect simply because of the nature that this has been escalated. I think some people are just coming to understand this is important, and if it's become formalized, it's probably even more important. So we'll continue to work to understand what enforcement will look like, but Manitobans should be clear. It means we're all taking this very seriously. If you've been traveling, if you've been from away, you get home and you stay at home.
On a similar note, earlier today, Dr. Brent Roussin said there would be further tightening of social distancing rules. When will you announce a reduction in the maximum gathering from 50, restricting restaurants to takeouts, banning hair salon visits, all things other provinces have done?
We have an availability with the chief every single day, and every single day we are measuring and watching and monitoring, and I would say stay tuned, because certainly everyone would understand that Manitoba has been taking appropriate actions and been acting very proactively. So I'd say you'll have to follow along, and we'll have more to say on the subject soon. But in the meantime, we say to all Manitobans, be careful and respect those signals that are being sent by the chief, including the need to continue to isolate yourself, or I should say to distance yourself, minimum 2 meters, both indoors and outdoors.
Thank you.
From City TV, Stephanie.
Hi, Minister. It's Stephanie from City News. Just wondering, you said you saw a list of supplies coming to Manitoba. Were you concerned about a lack of anything on that list, or were you looking for more of a certain item that you saw on that list?
Well, I'd say this. We are expecting a lot more supply to come our way. And because we were the first province to sign on to that joint procurement exercise, we have every expectation that it will be a timely delivery. However, we know that the shortages on some items is a global shortage. So could we use more N95 masks? Yeah, there wouldn't be a health minister in Canada today who wouldn't say so. Could we use more gloves and sterilizing agents? Yes, we could. We are encouraged by the materials that have been delivered thus far, but we will closely monitor supply and we will be continuing to work collaboratively with the federal government to make sure that product is on its way.
And then just a quick follow-up on the chest compression systems. How is that search going right now?
So I understand that these are the CPR machines that are strapped onto patients, and we've made this order. I would have to get for you an update on how it's going to procure that product into jurisdiction, but I'm pleased to know that the order has been placed, and this, I think, speaks to the extent to which we're working with our procurement officials to be able to say what is needed, where will we need it, and let's order now and not when we're in a much busier state in our healthcare system.
Thank you.
Carol from the Free Press.
Hi, Mr. Friesen. Today we had our first positive case involving someone who's ended up in intensive care. And I'm wondering if you can tell us if she was, the woman in her 60s, showed up at the hospital with symptoms, or if she had previously been tested. Did she test positive earlier and her situation worsened? Is there anything you can tell Manitobans about what happened when the case was?
Sorry, I cannot, according to the rules. But I do understand that there was a good availability this morning with the Chief Provincial Public Officer, and I understand that he had provided all the information at that time that he was able to.
So no comment on the first ICU patient, and you can't say if they're in the ICU that was created specifically as a containment for patients. Do you know that? So
first, let me clarify. There's no comment because of our privacy laws that prohibit me as a minister from commenting on specific identifying information about a patient. The second question has to do with ICU capacity. I'm not sure I heard the whole question. Repeat if you need to, but we are pleased with the state of preparations at Health Sciences Centre for a dedicated ICU for COVID-19 patients. I can update Manitobans and let them know I'm going there later today to personally monitor the progress of those preparations. I understand that we are working well to then reposition and then to move patients from a ward to auxiliary space that we now have at the old Women's Pavilion, and that is allowing us to dedicate this space.
From CTV Winnipeg, Michelle.
Hi, Mr. Friesen. I'm just wondering if you know where Manitoba sits with cases per capita and compared to other provinces.
Can you just repeat the question? I think I missed part of that.
Do you know where Manitoba is with cases per capita compared to other Canadian provinces?
Are you asking where we're getting instances of COVID-19 by cities and towns?
No, like where we compare per capita compared to other provinces.
Okay. I'm not sure I have that detail in front of me. You're talking about a per capita COVID-19 presumptive positive or confirmed positive jurisdiction to jurisdiction? If that's the question, if that's the question you're asking, I could update you and say we know that in Manitoba we have not seen the extent of COVID-19 cases that other jurisdictions have seen. Clearly, there are more cases, even per capita right now, in places like Ontario, British Columbia, and Quebec. And part of the reason for that, of course, is epidemiologists would tell us that's where the direct flights were from other international jurisdictions. However, that doesn't mean that it's not coming here. That is why the precautions we take on social distancing, that is why we ask travelers to stay home. But clearly, we cannot be fooled. We know that the numbers will go up. That is what this virus does. It expands and it increases exponentially. And that is why our efforts to create distance between us and our neighbors is so very important. I can report on those numbers perhaps with more detail tomorrow.
Okay, thank you. And then also, at any point would we, if we had a surplus of supplies, given that we're asking people to help out, is there any agreement between provinces to kind of help each other out if we get to that point?
I saw yesterday that the federal government had floated the idea of centralized resource administration and deployment at a federal level. And I think that probably that raised the eyebrows of a lot of Manitobans. We know that Canada is a confederation. We are a federation of provinces. We are not a republic. Healthcare is the responsibility of the provinces. And so we all want to help, and we all want to collaborate, and we all want to do the best we can. I think that we have to wait to hear more from the federal government of what they might mean in this regard, because we do know that our geography is very tricky in Canada. There's a lot of space between major cities, and I think that we would want to ensure that we were being as generous as we could with all Canadians, but also making sure that we were clear that we have to build capacity where capacity will be needed in Manitoba. So I think we'll have to wait and see more of what it is that the Federal Minister Haydu and the Prime Minister are thinking about that.
The Minister has time for a couple more quick questions.
CBC, Bobby Tigas here. Will there be interprovincial sharing of ventilators, Minister?
So I would say I would answer it with exactly the way I answered the last question. A lot remains to be seen when it comes to pronouncements made by the federal government less than 24 hours ago that they would like to have a role in resource allocation and deployment. Provinces have been building capacity. Provinces have been working hard to redeploy their healthcare human resources. Healthcare have been working very hard with the regulators and with labor to get ready. Clearly, there's a lot that the federal government is not saying yet about what they have in mind. So I think it's a balancing act. It's a balancing act between making sure that we're being good partners and we're being collaborative, like we're being on this procurement exercise to bring materials here. And at the same time, we've got a sacred responsibility here in Manitoba, and that is to safeguard the health of Manitobans. And that is top of mind for all of us in the government.
Steve Lambert from the Canadian Press. Minister, are you, as you look at the possible scenarios as this unfolds, are you in conjunction with the federal government looking at taking special measures to protect First Nations? Some of the First Nations, as you know, there's inadequate housing supply. There are concerns that a community spread could be much more rapid and have more impact there. Are you looking at special measures for First Nations?
We certainly are. We're working in collaboration with the federal government and the First Nations and Inuit Health Branch that has the responsibility for health care on First Nations communities. We have a First Nations and Métis representation on our incident command structure. We are every day liaising with chiefs. Our minister responsible for Indigenous and Northern relations is on the phone every single day with chiefs and communities in Northern Manitoba and in Southern and Central Manitoba to discuss those needs. It's a collaborative exercise. We know that the federal government announced more yesterday in terms of help, but we will be there to help.
Can you be specific about what the province is considering?
Well, I can say exactly this, that our Chief Provincial Public Health Officer actually did say that when it came to attaching priority in the testing of suspected cases, we're actually assigning priority to any case emanating from a First Nation community. We are endeavoring to get those cases tested and the result returned ASAP. It's only one of the ways in which we're helping, but we're talking a lot about perimeters, how to maintain maintain safe distance. We also had our chief take part, I believe, only 3 days ago in an online talk and an online chat forum with all First Nations leadership, and I think that was an excellent way to share information. Certainly, the Department of Northern Relations is working very hard and working in collaboration, as I said, with Indigenous Service Canada and FNIB, or First Nations Inuit Health Branch.
Minister Bartley, one more time. Have you been? Oh, sorry. Minister, have you been made aware in the last 2 hours since Dr. Roussin and then Minister Agusa stopped speaking? Have you been made aware of a death in the system that's related to COVID-19?
I have not.
Thank you.
All right, thank you very much. That concludes this afternoon's COVID-19 briefing.